You're listening to episode 138, a COVID-19 inspired health and happiness company for kids called Piper Enza. Hello, my friends. I'm so happy that you're here today. I am Katie Taylor, host of the Child Life On Call podcast. I'm also a child life specialist. For those of you who are joining us today and don't know what that is, we help kids and families in the hospital and out of the hospital in the community cope with challenging life events and medical experiences. So I'm glad that you're here, and I'm even more glad that you're here today because this is one of our quicker episodes, but it definitely packs the punch because you get to meet Rita from Piper Enza. If you follow me on Instagram, you've seen that I've been doing a little bit of work for them. I have been consulting as a child life specialist, but really what I've been doing is just watching in awe as Rita, who is a mom out of California, has really blossomed into this entrepreneur who is creating the most amazing health and happiness company, from children's books that are geared towards health topics to make things, less scary and more normal for people and for families. And then also just she actually created these great cloth masks that were KN95 masks that have just blown off the shelves. So her products, she is sourcing and finding the best materials, and that has not been easy through the crazy shipping industry of the COVID-19 pandemic. But nevertheless, she persisted. So please enjoy my friend and this amazing woman, Rita, who I hope inspires you to go out and not only look into what Piper Enza is doing, but just getting really creative with starting your own company. I think she's awesome. I hope you enjoy. Okay, really quick before we jump into the conversation. If you are a child life specialist and you are certified and you like cool people and you like to get really affordable PDUs and you love to share information and resources because you don't want to reinvent the wheel, then you need to come join us in the Child Life Circle community. We are child life specialists who not only chat on forums and share information, but we get really cool webinars from community organizations and also access to PDUs. So it is $14.99 a month until the end of October. So come in and join us, be a founding member, get to know us. We hope to see you. You can visit childlifeoncall.com, click on Child Life Circle to learn more information, including a letter to give to your employer to see if they can pay for your memberships. So, okay, join us there and we hope to see you.
My name is Rita. I'm mom of two. My girls now one just turned 8 last week and one is 5.5. My husband and I and our 2 kids live in beautiful Southern California. We're in La Cuneta, Flint Ridge, which is a neighboring town of Pasadena. In case you don't know what La Cuneta, where La Cuneta, Flint Ridge is. What else? Yeah, that's kind of me.
What do you guys like to do? Tell me a little bit about, what your family enjoys, just to get to know you a little bit.
Oh God, what do we enjoy?
I'm asking you at the tail end of summer when it's hard to enjoy anything.
I don't know anymore. I'm a music lover, so we love music. It's a thing in our family. My husband and I love to, ditch the kids to the babysitter, and we will go off to a concert. Classical, pop, what have you. We're we love that kind of a thing. I'm a homebody. I love crafting. I read a bit, so that's kind of my thing. My husband is the polar opposite of me. He's mountain biking and surfing, and he needs to swim. So I guess we complement each other well. So so if he's skiing, I'll be the one who's at home baking cookies.
Yes.
And it's interesting because now with the kids getting older, you can start to see them taking bits of traits from each of us. It's kind of funny. So Madalena, the old one, she is very much like me. She loves to read. She is a major bookworm. I had to pry a book off her hand today because she would not get ready for summer school. And I enrolled those kids in this surf camp this past 2 weeks just to see how it goes. surprisingly, my little one loves it. Like, you want to put a wetsuit on her. She's like, yes, put a wetsuit on me. I'm going to go boogie boarding. My old one, she's like, I'd rather read. So it's kind of interesting to see kind of like, okay, so now we're kind of starting to see what they like and they don't like and what they're gravitating towards. So that's kind of fun. As a family, we travel. We love traveling. After COVID, we are like with them so much. Yeah. Like every chance we get, we're like, go play. And the two of them just kind of play pretend. I think the other day they were playing Skylar Sisters. Nothing to do with, it's something to do with the Skylar Sisters, but I'm sure the script that they're making up has nothing to do with how the Skylar Sisters were. But yeah, so they do a lot of that.
I love that. Well, one of the things that stands out to me that you're mentioning about you and your oldest daughter is the reading. And tell us a little bit about kind of your aha moment when you realized you wanted to start Piper and Enza and what your vision is for it.
So Piper and Enza is very much a COVID-inspired a project, if you will. At the beginning, this was like 3 years ago. So my now 5.5 at the time was only 2.5. And it was really, really difficult to make her wear something, anything, any sort of a PPE, a mask when we go outside. Because at that time, I don't know if you remember, we didn't know anything about this virus. Everybody, we were in a lockdown. We had a little house. We had to get out. And it was just not healthy at that point. So that little one is stubborn as can be. And I don't know whose trait that is. It's definitely not mine. My husband and I giggle on that. So I tried everything. I tried making a headband, and we were exploring, maybe we'll wear a shield. Or I busted out my pile of cotton fun fabric that I used to sew for their baby blankets, and I had her pick out what she wanted. And I busted out my sewing machine. I was sewing her the masks so she would wear them. And then it dawned on me. It's like, so long I make it fun, and so long they like it, they will wear it, even though it may not be like their favorite thing, but they will comply. So I had to fight a much smaller battle, or no battle at all, if I made it fun. And that kind of became my mantra. And I kind of was like, wait a minute, like, is this how, doctors, nurses, or parents really should be doing? Is that, make children part of that. And then so based on that experience, I started to reach out to all of the preschool teachers. We happen to have one amazing guy here. His name is Todd Hioki. He is on our advisory board. I started talking to him, and then I came across this amazing group of people called Child Life Specialists. I don't know if you know one of them, that I never heard of, because we were very lucky. We never had the need for them, I guess, although I really think that they should be in every single pediatric dental pediatrician's office. That will make my life so much easier. I wish I knew them, but I didn't, because you're not available. And then I was like, what do I do? She's like, read books. If something is happening, you need to help the kids processing, or you need to help prepare them, books, children's books. And so with all these like little bits of information, I kind of like put the puzzle together. I'm like, okay, first of all, if we want to kind of process a certain thing that happened today, or we're about to embark on a journey, whether it's going on an airplane, get a filling in your teeth, or what have you, let's read something about it. The funny part is, as you dive into this, like researching for these things, they don't really exist. I'm like, this is insane. So there's a local bookstore, independent bookstore, Romans, here in Pasadena. They have the entire second floor. It's all children's books, the whole children's department, fill up the whole floor. And when you go look for health and medical experience related products, the real estate is 6 inches, and that's it. There is nothing else. So yeah, as an entrepreneur from my previous life, I'm like, well, let's do something about this. One is, we need books. We need a series of children's books based on one world. I always joke, like, what if Elsa and Anna can teach our girls and teach the children about everything? No parent, well, at least the ones that kids are, love Frozen, will need to struggle with anything anymore. So if we create a world where the characters are engaging and funny and something that the kids can connect to, and have them teach our children what is about to happen using children's language and really tap into that, then it's going to make all the parents' job so much easier. So that's how Piper Enza was born. That was the first project that I really started doing. It was really starting to do these books. I happened to kind of connect with a couple of my older friends. I don't think I've talked to them for like a good 10 years before this. And they're like, we're all parents now. They're like, yes, we need this. So everybody jumped on board, and we created now 2 books. We have a third one in the works. And it's really just based on Piper, our heroine, a little girl, 6-year-old girl, talking to her friends about a certain health experience, whether, her friend is about to go through, and really start kind of guiding the children through, okay, so this is how it looks like. What is that arc? And then we end the story with something realistic, at the doctor's office, and describe what will happen. So children know what to expect, and there is no surprises, and hopefully it will allow them to cope with that unknown situation, a little better.
We'll be right back. If you have ever wondered where you could get those cloth dolls that Child Life Specialists use with kids for medical education or sending home to siblings or to draw on for therapeutic activities, then you don't have to wonder any longer, because our friends at Smile Makers have decided to now sell these amazing cloth dolls for a very affordable price. I know that when I was in the hospital, I would have to rely on a volunteer network to then give us the dolls, which was really nice, but I had to wait a lot of times. Like, I would need a doll now and I wasn't able to get it. So this is a great place to be able to go get your procedure dolls at smilemakers.com. And y'all, they have 3 different skin tones for these cloth procedure dolls. In addition, you can actually buy a procedure doll prep bundle that comes with fabric markers. This is a fabulous way to do your medical teaching, to help siblings feel involved, to get kids creative, to do a lot of teaching about different diagnoses. And so go to smilemakers.com so you can get your cloth dolls as soon as possible before they run out. And when you go to that checkout to get your cloth dolls, also type in OnCall20 and you will get 20% off your entire order. So not just the cloth dolls. So if you get a bundle for Child Life Specialists, if you get a piece of furniture, if you get one of their really cool toys and prizes, or you order a large sticker order from them, OnCall20 gets you 20% off your whole order. That's smilemakers.com, code OnCall20 to get 20% off. I love that. Yeah. And I am lucky enough to have read both of the first 2 books. And one of the things that stood out to me, Rita, when we first met, is you said, Katie, I want at a first-year birthday party, a parent or family to be handed these, 10, 12, however many books it is, for everything from shots and doctor's appointments and dentists and needles and colds and everything that's within the health carescape that a family typically goes through. And they have language, and they have, like, just like you put it, like the Anna and Elsa, and they have Piper and Enza to help them teach it. And I would buy that for every friend who is just becoming a parent. And I think it's just such an amazing idea. And the quality of not only the illustrations, but the writing is so deep. And my kids read it and we chuckle, we're laughing. We're I like Piper, and it's really cool. You've done an amazing job.
Thank you. And that really, kudos to the creatives. There are a couple of funny dads who was always trying to joke around, and, it's been fun. And then I think that's the thing. That's really the lens we're looking at these things, that, everything that we do here is we're all going to go through growing pain, both parents and children. I mean, that's a constant thing. That is the constant thing throughout a person's life. It doesn't matter where you are. pain is inevitable, but suffering is optional. We don't have to suffer through it. And a lot of the time it's just a change of perspective, or sprinkle those instances with a little something that will bring a smile to your face. And that somehow makes the whole experience just a little more bearable for everyone involved. I think that's the thing. And then sometimes I was like, I wish I could make someone heal faster, but I can't. A lot of these things, your body needs the room and the time to do what it needs to do. And it is what it is. We can't change it. It's like that book. What is it? We're going through a bear hunt. You can't go over it. You can't go under it. You have to go through it. It is what it is. But if you are having a runny nose and, but you're able to take a fun bath, for instance, that has rainbow spewing out, great. And that's kind of like where we're going with this. We're not here to give medical advice. We're not, that's not kind of our thing. We're not qualified to do that. But if, as a parent, from my point of view, if we have gone through it, or what, that would have helped, or, and giving parents really these tools and a little bit of a preview about, that, how that journey looks like, then hopefully we will be able to help them stay regulated and hold space for their children. And I think that is a big thing too. As a grown-up, we don't know how it is like to be a 4-year-old, a 3-year-old, a 5-year-old. Our worldview is very different from their worldview. Our perception, our use of words, our understanding of words and context is very different. And oftentimes when you're caught in that moment, when you're, that panicking moment is like, oh my God, my kid is hurting. I don't know what to do. And they're screaming their head off. You're just kind of like, you're scrambling at that point. But if we have the tools and I'm like, okay, so this is happening. And, these are the signs I need to look for. If something doesn't happen, these are my plans. And I have all those things kind of nicely organized. I know what to say to my child. Then you're able to hold space for your kid and yourself. And I don't know, for me, that's invaluable. Just a family growing together.
Yeah.
So hopefully we'll be able to provide that, and empowering parents, to be their children's biggest advocate, because I think that's not happening enough. And it's kind of heartbreaking, because I know their children best, and then something happens and then they regret, oh, I should have spoken up, or I should have said something.
Yeah, I think that's in one of the parts that you spoke to was that, just before we started recording this call, we talked about how I talked about how I'm up to my ears, with the tantrums and the yelling and the fighting of being at home with kids during the summertime, especially toward the end. But so, and you also referred to your little rainbow bath bomb, and we have those from Piper and Enza, and they're so fun. And you're right. When I'm like, hey, it's time for bath, but we get to do this, that helps me. And then I can imagine if we had those available for every time one of us had a fever or runny nose, or whatever it was, that's something we get to look forward to about the process of being sick and the truth of being sick. You're bringing that fun, which was kind of your core mission at the beginning, and you're making it available throughout the lifetime. And I can't wait to see where you guys grow.
Thank you. We have a lot of things my brain is filled with fun ideas. So.
I love your brain. The other thing is, I think that this is just to the point of being very accessible and authentic, is that your child doesn't have to be diagnosed with a rare genetic disease or even an acute or chronic condition, but just a normal kid to get prepared for medical experiences. Your series of books, your products really help with that. So if people want to find you and learn more about Piper and Enza, you have such fun social media, but where can we look for the books when they're available?
There's a couple of places. There's always our online shop. You can find them at www.piperenza.com. Piper and Enza, ENZA.com. Oh, and to make the books more accessible, we have also recently launched them on Amazon as a paperback version. And those are shipped Prime. I ordered one myself to test it out. It got to my house in a couple of days. It's a softcover, and they are available worldwide.
That's amazing.
So,
congratulations.
If you have a friend who needs it in Australia, like, you'll be able to order it and then ship it to them. So that's kind of the model going forward, that we will launch a hardcover with more goodies on our website, and those are available for US and Canada. And, for everybody else who wants just something that's quick, you'll be able to order them through Amazon.com as well.
That's so great. Yeah, I think that would be a good option for a lot of child life specialists too, to just keep in their toolkit.
Yes, and it is also a lot more cost effective.
Yes,
too.
We like that.
That helps too. Yes.
Awesome. Well, thank you so much for being here. Is there anything else you wanted to share that I didn't ask you about yet?
No.
Okay.
I think just stay tuned. We have so many good things coming up, and I can't wait for you to all have a look and hopefully, help your family through these journeys.
Love it. Thank you. Thank you for listening to the Child Life On Call podcast. I'm your host, Katie Taylor, and you can follow us at Child Life On Call on Facebook, Twitter, and Instagram. Please rate and review to make it easier for other families to find us. We have cute merch available at www.bonfire.com/store/childlifeoncall, and you can listen to more episodes and find resources at childlifepodcast.com.